welcome back to the channel. Today we're going to talk about birth trauma. When I think of birth trauma, I think of things like bleeding and lacerations and seizures and all kinds of obstetric catastrophes that can happen. But what I'm talking about today is birth trauma in the form of psychological trauma, or PTSD, post-traumatic stress disorder, as it relates to pregnancy. Birth trauma first appeared on my radar as a term a few years ago when I was asked to give a lecture on the topic. And I had to pretty much start from scratch and do my homework to find out more about this, because I'm embarrassed to say that even though I consider myself a compassionate provider and I talk to my patients a lot, I try to listen to what they tell me, there's a whole unexplored area of the birth process that I think is kind of the dark side that people don't get into as much. And once I became more aware of that and started talking to more of my patients about it, the floodgates just kind of opened. People started telling me about their birth experiences and the negative aspect of them that they have had difficulty processing or getting through. And it's definitely made me a much stronger advocate for my patients in the labor and delivery setting. First, let's talk about a few terms. What is trauma? Trauma can be a physical injury, or it can be any perceived threat. And when you are in labor, especially if it's your first time, there are threats all around you. This is all a brand new experience. You don't really know what's going on. You don't know the people taking care of you for the most part, except for maybe your provider. So it's kind of a scary experience. Many pregnant women or postpartum women describe their birth experience as traumatic, and it's certainly a big and intense experience. So of course you're going to experience some trauma, some fear, some perceived threat. But most people who go through this process come out on the other side. They take their babies home, they recover from their vaginal delivery or their C-section, and life goes on and they're able to let go of that. But there's a group of women who just don't get over that trauma, or who have a little bit more trouble processing the fear that they experienced or the psychological threat that they experienced. When this happens, whether it's a result of giving birth or being shot at or being threatened, if you're not able to process that and get through it, then you develop what's called post-traumatic stress disorder, or PTSD. And symptoms are very similar no matter what trauma experience you had. And for women who have given birth and have had trauma associated with that, sometimes they have very scary memories of their cesarean delivery or an emergency that happened, or providers that didn't explain things as well as they should have. And their experience is that they keep reliving and dreaming about and just re-experiencing that traumatic event. It increases the risk for postpartum depression and anxiety. And it can cause trouble sleeping. It can cause problems with relationships with your spouse or partner, with your family, with your baby. Women who have experienced this trauma sometimes have trouble breastfeeding. They have trouble making a connection with their baby, which affects your whole family and you in particular. When I was preparing to give the lecture, I had to start from the beginning, and I wondered, how do you even study a topic that just seems so hard to pin down? What I found out was that when you're talking about psychological studies, you just gather a large group of women, usually online, and ask open-ended questions and invite people to tell their stories. And that's exactly what happened in these studies. And I will tell you, the descriptions that I have read were just heartbreaking. There are some women who described situations where a whole group of learners, residents, and students would walk into the room with the attending physician. Nobody would introduce themselves. Half the students were on their phones, and they were examined either without their permission or without being ready. Providers, nurses, and clinicians would tell people that they weren't experiencing things that they knew that they were experiencing. That's called denying your embodied knowledge. You know your body better than most of us do. Many women described telling their provider that they were getting ready to give birth or that they needed to push, and we're told, no, you don't. And then, 5 minutes later, of course, the baby appears. Many women were rushed off to cesarean deliveries without being really told what was going on. Everybody was just in such a hurry, and they were terrified. These experiences got a lot worse during the pandemic when patients were not able to bring in a support person or a loved one. So how do we begin to fix this problem? It seems like the trauma mostly is a result of just poor communication between the provider and the clinical staff and the patient. As a patient, you need to remember that you have a right to expect respectful care. You have a right to expect that everybody who walks in the room introduce themselves, and before anybody examines you, that they make sure that it's okay. They might ask if you have any problems or any issues with this or anything in your past that would make this a more traumatic event than it should be. Women are frequently afraid of being perceived as demanding or unpleasant. Just remember that you can ask questions in a perfectly pleasant way, but you need to be firm and remind your provider, who wants to take good care of you but doesn't always remember, that you don't know the same things that they know. And you have a right to ask these questions and know, so that you're all on the same page and you can have a good outcome and walk away from your delivery knowing that everybody's done the right things and you understand what's going on. The next message is to providers. We always need to be mindful of the fact that our experience is different from our patients, and what's not scary at all to us may be very scary to someone who has experienced sexual assault or who has been in an abusive relationship or who just feels like they're lost in a crowd and that you're not important to them and you're not paying attention to them. So we all want a good outcome for our patients. We just have to remember to communicate everything that we're doing, introduce anybody that comes into the room with you, and make sure that your patient is on board with whatever you're proposing. The outcome is always going to be better if you communicate your thoughts to the patient and let them know your thought process. Unfortunately, medicine sometimes lags behind by years or even decades, and so birth trauma is only now being recognized when it's obvious that this has been occurring for a long, long time. So you as patients and we as providers need to work together. Keep the communication lines open, and as you're preparing to give birth, talk with your provider about any fears or concerns that you have so that we can do better for you and for everyone who comes after you. Remember that mental health resources are available, and we're trying to make them more accessible for every person. Start with your OB provider or your primary care provider, and they can help you locate a mental health resource that's going to be convenient, affordable, and helpful for you. See you next time.